Welcome back. The ear is a sensory organ for hearing and also for balance and body position. Medical statistics reveal that 3 out of 4 children will have at least one ear infection by their 3rd birthday. And ear infections are one of the most commonest reasons children visit the hospital. Adults can also have ear infections, but they're less common. Joining us to show and discuss more on this is an ear expert, the ear, throat, and surgeon, right? Your ear, throat, and nose surgeon, Dr. Chinyere Asoegwu. Welcome to the show, madam.
Thank you.
So good to have you. So really, you actually do surgery on the ear, nose, and
throat?
Really?
And
interesting. I never met anybody that does that.
Well, you know, the funny thing is a lot of us don't actually value the ears. It's not...
Yeah, we don't.
When you have problems with the ear, you don't...
But let me throw something. What's the most common cause of ear infection that we get here, around here? Because I know that abroad, ear infection, the same way we say, I have malaria, my daughter has malaria. They always say ear infection. But here we look for, we're likely to say a child has malaria than an ear infection, usually. So what's the most common cause
or something
of ear infection? Is usually viral. A virus, upper respiratory tract infection. Well, before I start, I want to actually talk a bit on the ear.
Okay.
The ear is divided into outer ear, middle ear, and inner ear. The middle ear is inside the bone. It's a cavity inside the bone, so it's all bony. Apart from in the anterior area, where we have the eustachian tube. If you remember secondary school, the usual eustachian tube, it opens at the back of the nose, the nasopharynx.
Oh, that's the connection between the
That's
ear
the connection,
and the
yes. That's why I said I want to talk a bit about that. So, so when we say it's viral, it's because of upper respiratory tract infection, then the tract in through the eustachian tube, and then of course, well, it's already in the throat. The tube is in the throat because the throat is, we have the throat behind the nose, nasopharynx, throat behind the mouth, oropharynx, and the throat behind the larynx. Okay. So they are all throats.
As I said before, the children ear infection is not really very common anymore.
It's very common.
Okay.
It's just that, most of us, they're usually mild, one, and go unnoticed, but they're very common. In the clinic, we see a lot of children with ear infection. Or ear inflammation.
Well, before it gets to your own table, because usually if my daughter has an ear infection, the first thing I'll do, I'll take her to a normal doctor.
Yeah, to a pediatrician, to a GP.
Oh, to a normal GP. So, but before it gets to your level, what makes it? How do we come to you as an expert? At what point do we come to you as a surgeon?
It's supposed to be referred.
Referred from the
GP. I'm not supposed to see the acute infections. I'm supposed to see the complicated cases or recurrent cases. They are already tired of.
What are the symptoms? Because I have kids of almost 2, and I've never experienced. And they say they expect, maybe they've had, and I did not know. Yes. So what are the symptoms I should look out for? Because maybe somebody's just crying, and I might not know what's going on.
Yeah, it's one of them: irritability, excessive crying, and pulling the ear.
Yeah.
Yes, when they pull the ear, most mothers will, and when you touch it, it's tender. So that tells you that
like
the problem. It's from the ear.
They pull the ear and it's tender, then you know that something is wrong.
The child wouldn't even allow you to touch the ear. Okay. They are, pulling around their ear. Once your hand gets to the ear, they are jumpy. So you will know as something is happening in that ear.
Wait, we're seeing some pictures right now. This is the ear. So this is the outer ear, or is that the inner ear?
No, that's part of the outer ear. The auricle and then entrance to the sternal-auditory canal.
Is that pus in it?
No,
now,
I'm not sure.
Now, I wanted to ask you, because we're always told that we shouldn't clean our ears often because then we're removing the protection.
You shouldn't clean your ear at all.
You shouldn't clean your ear at all?
What? I was going to ask that actually. I was going to ask because
the ear cleans
how we clean with normal regular cotton buds.
Really?
The ear cleans
I clean
itself.
every single day.
Just listen. The ear cleans itself. Once you clean your ear, you cause what we call micro trauma. In the thing is sweeting you are there. When you have a pain, that's when you stop. There's a trauma. When it heals, there's going to be friction. So when the ear cleans, it heaps wax. Most people that form wax are those that clean their ear. Those who don't clean their ears are very clean.
What the banana?
But you see the wax.
No, but when it comes on the outside, yes, just don't use the cotton bud and go. Yes, on the outside. Yeah. Because the ear is lined, is covered by skin, the same skin. So it produces, the wax is the oil you wash every day.
I clean it inside and I'm going there every day.
Yes.
That is such a shocker.
Yeah, we shouldn't actually clean the ear. The ear cleans itself.
I've never heard that.
Then what if it's tickling you? Because, Tickling can be a symptom. I'm having a little throat infection. I've been using some lozenges, but my ear tickles and I'm
Does your throat tickle too?
Yeah, a little.
So that could be allergy. Because if you have allergy, there will be itching of the throat, the nose, the ear. So you're going to do all that while
Talking
others
about
are
allergies, how do we pick up allergy symptoms here in Nigeria? Because I don't see a lot of people talk about allergies.
You won't see them. They're all over the place. I see so many.
Really?
Of course.
Because I know, okay, this one is a severe case. Can we see the picture coming up right now?
Yeah.
That, in that case, what would you call that?
Well, this is like an otitis externa. Well, otitis is inflammation of the... well, there's no other name I can give you. He has his name. It's inflammation of the ear. That's otitis. Okay. So now it's externa if it's external ear, media if it is a middle ear, you know. So
this has gotten to a word, terrible state.
Well, it's not as terrible as it looks, you know.
Okay. So I did read a report that stated that a lot of times when we're feeling dizzy, we think it's migraines and all of that. A lot of times it's associated to the ear and ear infection and so. I'd like to know what are the symptoms, because Topper asked ear infection, is dizziness part of it?
Well, a layman's language, dizziness. For us, vertigo. Those are two different things. Dizzy is when you feel fainty. You know, vertigo is when you have the spinning sensation. Either you feel you're spinning or the environment is spinning. That's an ear symptom. That's dizziness of ear. But we call it vertigo. Because when you say dizziness, it does not have the spinning.
Oh, that's why they say the ear gives aids the balance.
Yeah, it does. There are organs in the ear that are for balance. The semicircular canals. They are the ones that balance you, whether in the air or any position you take.
Bringing me to when you fly and you feel that.
Exactly.
What do you do? Someone was saying take omega-3, someone was saying drink something.
No,
what
you feel that thing is the eustachian tube that is blocking up. Because of, especially when you're descending.
Can it burst?
Of course, the TM, the tympanic membrane can.
Oh, so how do we prevent it? In the plane, Abby?
Yes.
How do we prevent? What do we do?
That's why they give, at times they give you air.
No, those will not prevent it. You are supposed to either chew.
Gum,
that's the best thing.
Wow.
Oh, okay. So chewing gum when you're flying.
Yes, you chew, or you do what we call the Valsalva maneuver. You pinch your nose, close your mouth, and you try blowing your nose. So you're, you know.
The first time I ever traveled in my life, I acted as if I wanted to die.
Yes.
Remember,
it can be so
calm down,
bad.
you won't die. I'm like, I'm about to die. Oh my God, I can't breathe. Please, you'll be all right. Just keep chewing. Yes.
Well, you know, the tympanic membrane, that's the eardrum. When it bursts, do you need to have surgery to fix it back, or does it fix back on itself?
No, it can heal just like any other part of it. But if it bursts and there's secondary infection and the perforation gets wider, then that's when you need.
Now, for those people that are born deaf, what happens? Well, how come? What causes that? Because we see some of that happening.
Well, we say that
corrected.
No, yes and no. We say that deafness or hearing impairment is one of the commonest illness associated with syndromes. You know, all this mongo, all the syndromic things we see in children born with abnormalities. Hearing impairment is very common in them.
Wow.
Well, the word deafness I want to keep, because for us, deafness is when you have profound hearing loss. That's if you can only hear like the sound of the train, the horn of the train, that's not hearing. You know, so we call that deafness.
Look, let me take Victory's call. We'll come back to this topic. Good morning, Victory. Are you there?
Nice to see you this wonderful morning.
Morning, sir. Go ahead.
And a splendid morning to everyone in the studio, to be your doctor.
Good morning.
The fact is that in Nigeria, most of the women these days does not even have maternal instinct. Most of them don't even care. Something is wrong with their kids. Feed them. The guys are even giving them some science, like the doctor said, but some ignorant. They don't even care.
Observant.
You understand? And that's just it.
All right.
I just feel
thank you.
Because it has educated a lot of women, even a lot of people as well.
So, okay, thanks, Victory.
Mr. Victory, it's not only women that need to observe their children. The men are also fathers, and they should observe the children too.
At the same time, I think it's important for, I think the point is making, women, we have to be observant and very, very vigilant. Because all the one that your child is touching their ears and the ears, so that's something that you as a mother would likely to pick up on faster than the father. So before it gets to that stage, that worst stage, it's important.
That's why I pointed the finger back.
Sakina, go ahead. Sakina, do you have any other questions for the doctor?
No, that's all. That's about it.
Well, I have a question on Twitter, which I actually think you've answered, but let me just read out his tweet. Wole Ogunwale asks, Please ask the doctor, what should we do when the ear is itching us? Because I use cotton board to clean whenever my ear is itching. I think you've answered that.
Well, there are, yes, sometimes it's not just only allergy that can cause the ear to itch. If you have a fungal infection, which most of us get from the cotton board we use, because they are not sterile. You know, they could have fungal spores in them, and then as you clean, you introduce them. So if they have a fungal infection, it has to be treated. And sometimes there are deposits that needs to be washed out, debris, fungal spores, you know, and all that need to be washed
sometimes
out.
When you have itchy
So they
ears,
wash the hair?
Well,
yes, of course.
Sometimes when you have the itchy ears, you make that sound with them.
Now, I do that a lot.
When you do that, it's not your ear, it's your throat. That one you're doing now is itchy throat.
Oh, but
it's affecting the
ears. Yes, the ear also is itching, but that is usually people are itching their throat.
Sorry, please. What about echoing? When you echo, do you know at times your
the
your
ear can echo when you have what we call otitis media with effusion. That's simply put water in the middle ear. You know, many times people say, I bathed, water entered my ear.
How do you get
refuse
it out?
to run out. It's a lie. It's not the water that entered your ear. The canal is closed by the eardrum. So even if you pour a drum of water into the ear and you turn your ear, it comes out.
Oh, really?
That one you're feeling is in the middle ear.
Ah.
Yeah, so we call it otitis media with effusion. When you have that, because sound traveling through water, you know, is slower than traveling through air. And it's supposed to be air that is in the middle ear. So the sound, you know, so you have that echoing. So those are all symptoms of otitis media with effusion. So if you have that, what we usually have, you have upper respiratory tract infection.
I have a question. Okay, I have a question, but let me take a call. Kuma, I think it's Nelson, I believe. Mercy, actually. Sorry, Mercy. Sorry about that. Good morning. Are you there? Morning.
Good morning.
Morning.
Please, I want to pass a question to the doctor.
Yes, please.
I had an accident last week, Tuesday, exactly a week today. So when I was in the hospital, my eyes were skinny. I told the doctor, and the doctor told me that there is imbalance in my eardrum. And I'm bringing out some clotted blood from my mouth. This time I cough out. How sad is that? Because I tried to tell the doctor if we should run X-ray on it, and he said there is no need for it.
If you have, so many things can cause vertigo, like I said. It's not only here. When people have vertigo, we start checking from eyes. When did you have your last, checkup? Yeah.
What's vertigo?
That's the dizziness with the spinning and all that, you know. So even we check so many things, even for diabetic patients, the sensory on their feet. Because if the nerves are affected, that also will affect your balance, you know.
So this lady that just called, she said she was spitting that. How serious is it?
She was spitting blood, you know.
Blood or something.
Well, that's what she called it. It's probably that she had epistaxis, bleeding from the nose, and it was entering the mouth through the back of the
Yes, Sans, go ahead. Let me ask.
Yeah, I wanted to ask you the prevalent infections we have in Nigeria, because we've talked a lot about symptoms, but I would like us to list like the proper ear infections, because a lot of us don't know. We don't take care of the ear.
The infections, we divide them into acute, chronic. The acute one, viral, bacterial, can be fungal, you know, affecting either the outer ear, the middle ear, which other part it affects will determine the symptoms that
I need to ask a question concerning first aid. When a child comes home and says, "Oh, something's in my ear," they're not sure
like
they find something inside their ear. Yeah. What's the first thing you do? I mean, obviously, go to the hospital, but what can you do to activate if it's moving, far away?
If it's moving, if it's a fly or cockroach, you have a lot of cockroaches in the ear. If it is, put oil. You know, that suffocates whatever animal.
Pour oil inside.
Pour oil. That will suffocate
the oil, the fly.
They will fly. Wow. Then that's where you stop.
And how would it come out?
No, you now go to hospital where it will now be brought out. But you know,
if mine, it came out, I had a small ant in my ear and I put oil and then I did like this and
you were lucky, it crawled out.
It crawled out with the
Some
oil.
Wouldn't, you know.
But do you have to put oil? What is the earwax there for?
There's no earwax there. Normally, there's no wax.
Look, I think I have a call to me. Good morning, are you there?
Good morning, I'm there.
Yes, ma'am, go ahead.
The doctor said that it's not good to clean our ears.
Yes.
How about babies? When we just have babies?
They, more importantly, don't clean their ears. You don't know the ear canal that you're cleaning, you don't know its shape. It's actually S-shaped. It's not a straight canal. That's why you're traumatized. So when you go, you shook the wall and injure the wall. So don't even clean the babies at all for us, please.
Wow, interesting. I mean, I learned that. So what's the function of an earbud? All those
for business people.
Oh,
sorry,
cosmetic. It's for the business people.
Oh, it's for people like you.
To sell, you know.
I never run out of those things. I mean, I'm so
Exactly.
Baby, people buying baby things. Majority
of your
Exactly. So I'm thinking,
items
if this cotton bud is actually not so beneficial to the ear, why haven't, you know, your people in your field of work made, you know, raise the protest
causes
against
cancer
it?
of the lungs. So how come that
they've not eradicated it
all over the TV, radio?
We should not go there.
Don't go into it today.
Okay.
But I know we're talking about ears, but something else, the nose. That just because I know you also cover that.
Yes.
Now, picking of nose and bleeding nose. My husband suffers a lot from nose bleeding, and he read somewhere online that picking nose causes nose bleeding. So is it right to clean the nose? Just same way with the ear. Can we clean our nose, or we should just leave it there like that?
What are you cleaning the nose for?
All that stuff, that all the mucus thing that
if you have
so hard.
rhinitis, if you have whatever, well, if you can have catarrh, but catarrh is not a word, because to four of us now it may mean different things to us, you know.
But
if you have a running nose,
around your
nose,
if
you have a running nose and all that, you actually prefer that you put something that has the Vaseline base, you know, so it can slide out. Though picking of nose is the commonest cause of nosebleeds, but those are minor nosebleeds, usually mainly for children. When somebody have recurrent nosebleeds, please, that could mean so many things.
All right.
So
we shouldn't
just
like all this one that you
shouldn't justify. We shouldn't just justify.
Yeah, don't just
think
it is that.
Then going to the clothes. A lot of people have this goiter issue. What are the symptoms? When do you know there's a problem with your goiter?
Well, goiter is the swelling of the thyroid gland. It could just be swollen and there's no problem. It's secreting normally.
Live like that forever.
No. Cosmetics, you remove it. You know, but sometimes it's not even swollen, but it's giving symptoms like the Graves' disease. The eye is popping out. You're sweating. You know, everything, it comes out like sweat in your body.
Let me take Yakub's call. Good morning, Yakub. Are you there?
I'm there.
Yes.
Yeah, good morning.
Good morning.
I want to ask a question. I want to take a question to the doctor.
Yeah.
My question is this. I went to some hair clinic. There I met some certain people there. They are using something like hair bleach. They say they are there for something. But at long run, they are cleaning some hair piece. They put their hair piece to make them hear. I want to know what is that hair piece all about. For somebody that doesn't hear. Doesn't hear.
It's a hearing
all
aid.
about?
Okay. Well, it's hearing aid. It's not just earpiece. It's a hearing aid, which we use for some. It's not every deaf person that benefits from that, you know, but most will benefit from that. We even do cochlear implants
for
now.
Old age.
Okay, all right.
Yeah.
Okay, so I'm going to ask you one final question. What are foods we should take to aid hearing?
The normal food, I think the more important ones are the things we shouldn't take.
Okay,
you know, but most of them are in the areas of drug. Some drugs are very ototoxic. They are toxic to the ear, like the gentamicins, you know, the gent that people give out so easily. Furosemide, some of the chemotherapies we use for cancer.
I'd like to ask something, because I tend to use my earpiece a lot to listen to, watch movies and all that, and listen to music. What's the damage that can happen to me with using the side effects
I've actually
the earpiece?
carried out a research on that. We did a research on impact of that on the ear of medical students in Luth compound, and we found out that nothing, except if you're listening to it at very high volume, sound destroys the ear. So if you're listening to it in a noisy environment, that means you have to raise the volume. That's what affects you.
With a normal volume, you're fine.
Normal volume.
Let's do some final tweets so we can close this. Good morning.
We still have a lot of people talking on the medical checkup. And okay, I'll just have some tweets on medical checkup. Ekundayo said, Ekundayo, pardon me, says, checkup is for the rich, because if you have heart-related issues and you are poor, ordinary health centers cannot diagnose you. And Josephine Olatunde says, my foster mom went for medical checkup. She was so happy that morning. And 30 minutes later, the driver called to say my mom is gone. And Olua, no.
okay, Eno Abasi. Did I get that right? Said, good morning, all. Most people do not go for checkup because they are scared of what they will be diagnosed at the end of the checkup.
Generally, I think we've talked on basically everything. Ladies, thank you very much for on the show. Halaja Sakina, did you enjoy the show this morning?
I did.
You're not too nervous.
We enjoyed you.
No, you can say that again. As nervous as you can.
Good to have you on the show, though.
Thank you so much.
Doctor, thank you so much for coming.
Thank you.
Honestly, I'll come and visit you because I never even knew this kind of doctors existed, honestly. Thank you very much for coming. We appreciate it. Yeah. Don't forget to watch a repeat broadcast of this program at 11:30 p.m. tonight. You can also watch previous episodes on YouTube. And as always, global statistics report that 3,000 people die daily from road traffic accidents. Please wear a seatbelt and obey traffic laws. It saves lives. God bless you. See you tomorrow morning.